Hi everyone, welcome to another episode of Aesthetic Minutes Clinical Vignettes. On today's case, we have a healthy 24-year-old male interested in the correction of his prominent ears. He has been bothered by the size and prominence of his ears since childhood and is finally ready to have this minor issue addressed. Today's case was submitted by Dr. Sagar Patel, a facial plastic surgeon practicing in Beverly Hills, California, specializing in otoplasty. You can find more information on Dr. Patel's surgical practice, including his YouTube channel Sagar Patel Aesthetics, below in this video's description. Although the size and shape of the ears vary from person to person, when the ears are too prominent, a condition known as Prominauris, they can distract from the person's central features. Prominauris is corrected through a surgical procedure known as an otoplasty, and in order to understand how this condition is treated, we must first review some basic ear anatomy. The human ear, also known as the auricle, is an irregularly shaped structure composed of different segments, including the conchal bowl, helix, antihelix, and the earlobe. Between the helix and the antihelix lies the scaphoid fossa. When we look at the auricle and cross-section, it's clear that the degree to which the ears project from the head depends largely on the angle that the auricle makes with the skull, specifically the mastoid bone. This angle is known as the auriculocephalic angle, and in normal ears it measures between 20 and 30 degrees, which results in an ear that projects approximately 2 to 2.5 centimeters from the skull. The auriculocephalic angle itself depends on two other angles: the conchomastoid angle located between the conchal bowl and the mastoid bone, and the conchoscaphoid angle located between the conchal bowl and the scaphoid fossa. Each of these component angles typically measures around 90 degrees, and this is the reason why the normal ear projects from the skull the way it does. Because the normal size and shape of the ear depends on a variety of angles and features, there can be multiple causes of Prominauris. The most common cause of Prominauris occurs when the antihelix fails to fold adequately. In such instances, the conchoscaphoid angle is much wider, making the ears appear bigger, even if they are otherwise of normal size. Correction to Prominauris due to this issue is done through a simple surgical technique known as a mustard suture, named after the surgeon who first described it. In this technique, the surgeon meticulously places several key mattress sutures into the cartilage through an incision made behind the ear. Once tied, these permanent sutures reshape the ear to create a more defined antihelix, which in the process forces the helix to fold back against the skull, reducing the size and visibility of the ears on frontal view. The second cause of Prominauris is a wide conchomastoid angle. If the conchomastoid angle is large, even with the normal antihelix, the ear will project too far from the skull, resulting in Prominauris. This common issue is also fixed through a simple suture technique that is known as a Furness setback. In this technique, several permanent mattress sutures are used to pin the ear back against the skull, reducing the conchomastoid angle and thus the auriculocephalic angle as well. The mustard and Furness suture techniques are simple surgical procedures that can be done quickly and with minimal downtime. However, in some patients, a third common cause of Prominauris, known as conchal cartilage excess, can also exist, which requires additional work to correct. In these patients, the conchal bowls are excessively large, causing the ears to project too far from the skull. The correction of this issue requires the removal of a wedge of cartilage from the back of the conchal bowl through the same incision used in other techniques. This reduces the size of the bowl, which in turn decreases the projection and visibility of the ears. In Dr. Patel's patient, all three causes of Prominauris are present. The antihelix is poorly defined, resulting in a wide conchoscaphoid angle. In addition, the conchal bowl is relatively large and excessively rotated away from the skull. As a result, the surgical recommendations for this patient included an otoplasty with the following maneuvers: a mustard suture technique to improve the antihelical fold, a conchal bowl reduction to decrease the lateral projection of the ear, and a Furness setback to rotate the ear against the skull. The patient underwent the procedure successfully, which required approximately 1 hour of operative time and a local anesthesia and only a few days of surgical downtime. He healed well and recovered without any issues. Here are this patient's results 6 weeks post-procedure.